Hi, everyone. Thank you for joining us today. Welcome to HDR UK's Black Internship Program celebratory event. Today, we have gathered to celebrate 5 years of the amazing Black Internship Program. If you don't know anything about it, don't worry. At the end of this webinar, you'd agree with me that this program has truly been transformational and amazing. Even though we're here gathered to celebrate 5 years of impact, we're also gathered to build momentum for the future, the next 5, 10, 15, or even 20 years. Um, my name is Favor, and I was part of the 2023 set of the Black Internship Program. I'm currently in the second year of my PhD in computer science at the University of Sheffield, and co-hosting with me today is Emmanuel.
Yeah, thanks, Favor. Hi, everyone. So my name is Emmanuel, and I was part of the 2024 HDR UK Black Internship Program. Currently, I am a data analyst at the UK Health Security Agency, where I work with public health data that impact lives. I'm really pleased to be co-hosting today, and as we celebrate 5 years of the Black Internship Program, I'm just so excited. So before we get started, I would like to take a moment to share a quick note on the meeting values that guide all AGR UK events. At AGR UK, we ask everyone attending our events to uphold the values that guide how we work together. So these values shape the spirit of our meetings, and we encourage everyone to demonstrate them throughout our time together. So I'll quickly run through them. The first is transparency. So anyone is free to use information shared in today's discussion, but no comments will be attributed to individuals. The next is optimism. We welcome contributions that are positive and solutions focused. And the third is respect. We promote a culture of tolerance and inclusivity for everyone. And we move to courage. So feel free to challenge ideas constructively and try out new things. The last but not the least is humility. We learn from one another and value the diverse perspectives in the room. So if you would like to read our full meeting guidelines and the event etiquette, they are available in the AGR UK website. Okay, so now to the more interesting part. Just as Favor has said, what are we here to do today? So today we are here to celebrate 5 years of the Black Internship Program. And as Favor has said, to explore the impact this program has had on interns, on hosts, and on the wider data science community. We'll also be looking ahead to what the next 5 years might hold. So it promises to be a very exciting webinar today. And then before we dive into the rest of the program, I will pass over to my co-host, Favor, to take us through the housekeeping.
Thank you so much, Emmanuel. Right. So, as you might have noticed, this webinar is being recorded, and the recording will be made available if you want to go back and check something. Trust me, you will want to do that because we have lots of amazing speakers with us today. Closed captioning is available as well if you'd like to enable that. It's on the screen and you can enable that. Microphones have been automatically muted just to keep things orderly. The hand up function is disabled as well. If you have any questions, there's a Q&A function and you can submit your questions there. We're going to have an amazing panel discussion. You might be wondering why I'm saying it's amazing. Trust me, I know the speakers and I know it's going to be an amazing panel session. So towards the end of the webinar this morning, we would have a panel discussion. So if you have any questions, no question is stupid. If you have anything at all, please make sure to use the Q&A function and we'll be sure to pick up your questions and pass it on to our amazing panelists. All right, so moving on, I'm going to pass over to Emmanuel now, who is going to introduce us to our first speaker.
You're muted, Emmanuel.
Okay.
That's the pain of online meetings. Thank you so much, Favor. Thank you, Favor. So to begin our speaker contributions, it is a pleasure to introduce Professor Martin Levermont. So Martin is the chair of the HDR UK Black Internship Program Advisory Board, a child of the Windrush generation, and the CEO of Medical Devices Technology International. He is also a member of the Pioneer Acute Care Health Data Hub and a serial entrepreneur. So Martin has been involved in the Black Internship Program since its inception, and today he'll be reflecting on the program's growth and development over the past 5 years, as well as its potential and ambition for the next 5 years. I would now like to invite Professor Martin to share his reflections. Thank you.
Good morning, Emmanuel. Good morning, Favor, and good morning, all. It is my great pleasure to be with you this morning. And as Emmanuel says, just to step back and give a reflection of where we have come from. And I'm hoping that out there in the audience today is Caroline, because this program didn't come about just because of certain incidents. It was quite a conscious approach. Caroline and myself, with a number in HDR UK, way back in 2018, decided to look at our sector and try to make it reflective. Like everything, we had to go through a design process. And whilst that design process, the world went through change. We all can remember COVID-19. And for some of us, we can also remember the horrific deaths that passed within certain communities. We recognize and witness profound change in the political landscape that led to the death of George Floyd and the rise of Black Lives Matter. But that past, that change in society was only reflective of something bigger that was taking place. HDR UK recognized that way before the sprinkling change. And more importantly, we recognize that the value of HDR UK needed to be sustained. To that extent, I am pleased to say that from the time we piloted the Black Internship Program, we started to recognize that the sector was more than just individuals. It was something that actually raised and looked to changes, something that actually could enhance and bring individuals together to answer real world challenges. And I know that is what this program has done, and has also remained humble in its achievements. Next slide. Together, interns and hosts and those in the back office have done a tremendous job in showing an impactful program, from starting from only under 50 interns back in 2021. We have accelerated in such a short period of time interns who've actually seen this sector as being something of value, importance, and engaging. Like that, the host organizations. As such, I am proud to look to the next 5 years. Next slide. In ensuring that we now take this to the next level. We actually show and showcase the best of UK PLC by harnessing the diverse talent pool, the diaspora that is connected on a global basis, that we can actually not only demonstrate social mobility, but economic ability for all those that have entered in this space. HDR UK, I am sure, will continue to inspire, lead, and more importantly, show the collective value of the people, the assets that richly deserve a sustainable mindset that I know UK PLC deliver the rest of the world. Again, thank you all for your contributions, your engagement, but more importantly, please keep those drums banging of what is best for UK and health data science. Thank you very much.
Thank you so much, Martin, for that amazing, amazing welcome talk. And just to highlight a couple of things you said and just, pick up on that. You mentioned talking about people and the pool of talent. I think that that's the most important thing that the Black Internship Program stands for. There's a lot of people who would have been lost, if you want to use that word, without the Black Internship Program. I think I can confidently say that I am one of those people who would have been lost into the sea of whatever, forgetfulness, I guess you might say, if the Black Internship Program did not exist. And I guess it also goes to show how much of an impact the program has had over the years to see the upward growth in the trend from year to year, not only in intern applications, but also in commitments from hosts. I'm very excited for how far we've come in 5 years and looking forward to what we can do in the next, I keep saying 20 years, but yeah, I'm looking forward to what we can do from now until our 20th celebration. Thank you so much once again. Next, we're going to have Penny come and give us a talk on the results of the evaluation. So a couple months ago, or was it last year, there was an independent evaluation of intern experiences, so like alumni intern experiences with the Black Internship Program. And Penny led that evaluation. So Penny is a mixed methods researcher at Advanced Higher Education, and she specializes in EDI considerations in higher education. And like I said, she led the evaluation of the Black Internship Program. So please join me in welcoming Penny as she comes to talk to us about the results of the evaluation.
Thank you very, very much, Favor. Thank you, Emmanuel. Thank you to the entire Black Internship Program team for bringing me on board to do this amazing piece of work. So as Favor said, this evaluation was conducted last year between October and March. And what I will do today is I'll give you a very whistle-stop tour to the evaluation report, just providing a summary and some highlights. Next 2 slides. So I'll start off with the purpose. That was already developed by the HDR UK team, and the evaluation had to serve 4 objectives. Firstly, the team wanted to evaluate the program in terms of its design as well as implementation, and we wanted specifically to engage with both alumni and host organization staff. We did want to determine whether the program has been delivering its intended outcomes and outputs. And we did want to have a look at what the program's value and influence was for HDR UK as well as the wider health data science sector, before we are able to back up with evidence, some recommendations to inform the scope and delivery of the future iterations of the program for the next 20 years, as Favor says. Next slide, please. And one more. So we employed a multi-pronged, multi-stage methodology and approach to deliver holistically this piece of work, which started with developing a theory of change, which was our framework underpinning this evaluation. We engaged with a variety of key stakeholders that are engaged in the program, and we co-developed the framework through 2 co-creation workshops. We also conducted a desk-based review using data that the Black Internship Program team provided to us, so secondary data. And we also did a comparative analysis of the Black Internship Program with similar initiatives running both in the UK, but also internationally. And we summed things up with our stakeholder consultation, which included 2 online surveys, 1 targeting alumni of the program and 1 targeting host organization staff. And as you can see on the slide, we had pretty good response rates in both, which we were very pleased about. We also run 3 alumni follow-up focus groups with people who self-selected through the survey, and also did 11 one-to-one online interviews with key stakeholders from host organization, HDR UK, but also the wider health data science sector. Next slide, please. And one more. So here is the easy piece of work for me, because as Favor says, this program has been amazing, and that's what we found throughout our engagement with the variety of stakeholders. So on the left-hand side, you can see the cover page of the report, which I strongly encourage you to go and read, because there is a vast array and amount of data. And on the right-hand side is some of the highlights that I think showcase the great impact that this program has had between the first 4 years of its operations, which were the ones in scope for the evaluation. So 308 interns were successfully placed across these 4 years, and 98 host organizations hosted interns. One of the most important figures is this 43% of alumni survey respondents who indicated that they have entered health data science related careers or are continuing their studies in relevant fields after their engagement with the program. And 70% of those alumni that completed the survey indicated that the program had a strong or very strong influence on their confidence to pursue a career in the field. When we looked at host organizations, staff, 93% of those agreed that interns were job ready on completion of the Black Internship Program. And around 2/3 of them, so 67%, said that participation in the Black Internship Program really helped them understand the barriers faced by Black people in the health data science sector. Next slide, please. So in the next 2 slides, I will just try and flesh out the data and figures with some of the lovely things that alumni and host organization staff shared with us. So for the alumni impact, I've chosen to showcase just the career progression, which is obviously one of the main measures of outcome and impact for the program. And as I said previously, we have a very sizable amount of interns that do go on to continue their professional careers or studies within the health data science sector. You see 3 of those on the slide. So Jadine, George, and Happiness, all from different cohorts. And you see that they are still engaging in the health data science sector, either with a job or with pursuing PhD studies. And as you can see, some of them continue to work with the host organizations they were hosted for as part of their Black Internship Program. Which is another great indication of the sustained relationships and this direct match between host organizations and alumni that this program bolsters. And on the very right-hand side is a quote that I think captures the essence of what the Black Internship Program is about, because I was struck by the willingness, the passion, particularly that alumni showed, and I'm sure you can see that with Favor and Emmanuel here today. So the quote says, "The Black Internship Program is one of the only opportunities you have as a Black person in data science, in health data science, in tech, to be fully, authentically Black, without fear of judgment, without fear of being misunderstood." Everyone who has passed through the program does have this idea of it being a pivotal moment for their career, but also for the personal development of interns. And oftentimes the program is described as a community of people. It is about bringing people together and building relationships, both within the peers, but also with host organization and wider stakeholders. Next slide, please. So we move on to what the host organization staff have to say, and it's a very similar story of success. So in these two quotes, I think some of the main things are highlighted again in terms of the evidence that showcase the great impact that the program has had. For those, the first one on the left-hand side talks about how they love engaging, how engaged and motivated the interns that apply and are successful for the program are. The host organization staff are confident that this experience they provide for them will help them to get further opportunities within the sector, which the evidence shows that it does happen. In general, host organizations do value the opportunity they have been afforded through the program to host these talented people and have access to this pool of participants that otherwise they wouldn't have. And it does open their eyes to understanding the barriers that Black people face and what they can do to incorporate processes, practices when it comes to their own recruitment further down the line to try and become more inclusive as organizations. On the right-hand side, you also see the acknowledgement of how well run this program is and the kind of support that is offered to the host organization from the program delivery team, which is what keeps host organization staff in combination with the quality of the interns they get to continue their engagement year after year with the program. Next slide, please. Okay, so recommendations. We did come up with these 4 recommendations, and the first one, I think Martin has already touched on his opening speech, which was the idea of co-designing what the next phase of the program looks like, and it was very clear that this needed to be communal decision. The review did provide evidence that could support either the expansion or the scaling up and branching out of the program, or the retainment of this tight-knit community between interns and the supportive relationships that smaller scale programs allow for. But the increase in the demand in the program from application growth and the turnover of host organization staff being high and not these two lines not being growing at the same rate does indicate that it is probably there is a need to scale the program up with the growth in available internships to meet the rise in demand. The second recommendation was to expand the delivery team's capacity and increase the resilience of the host organization pipeline while remaining, lean. The recruitment of a new head of the Black Internship Program to drive delivery of strategic planning, including things like expanding the host organization pipeline and to consider viable options to ensure the program's long-term funding, is a great sign of progress towards this implementation, towards this recommendation. The third point was to strengthen the external communications to further promote how great this program is and the impact it has, and clarify the host organization offer, with some of the ideas here being to utilize alumni career stories, host organization staff testimonials, and sector experts' opinion pieces, and make use of some of the evidence I presented in terms of what's in it for the host organization staff. The final recommendation was a continuous focus on feedback, monitoring, and evaluation. This review is just an evidence of the team's commitment to this, and obviously as time passes, other elements within the evaluation cycle will become more prominent, and that will become the main area of focus. As the program progresses, there will be more focus on longer-term outcomes and impact, such as the long-term career tracking of alumni or a review of the general practices used to engage interns in host organization. That is it for me today. Thank you very, very much. And I'm happy to get your questions later on today. Thank you.
Thank you so much, Penny, for those insights. especially your reflections on why the evolution took place, how it was carried out, and what the key findings and next steps mean for the program going forward. They were really, really great insight. Thank you once more. We'll now move into our keynote for today. It is my pleasure to introduce Yambe Suma Nyambe. So Yam is a founder of the Black Shepherd and the 29K Club, and his work focuses on helping individuals unlock purpose, confidence, and fulfillment in their careers, particularly those navigating structural and cultural barriers in fields like STEM and health data science. So in today's keynote, Ian will be exploring some of the broader themes around representation, opportunity, and the experience of underrepresented talent and what it takes to build an environment where people can truly thrive. We are really looking forward to hearing your perspective, Yambi. So I would like to invite you now to deliver your keynote. Thank you.
Thank you very much, Emmanuel. I need to take you with me. I need that type of introduction everywhere I go. It makes me feel very special. And thank you, Penny. Just in that last section there, evidence and data is the cornerstone of our industry. And I think it's so great to see such a robust report on the impact that this program is having. The next 20 minutes, I'm probably going to tune into a little bit more of Martin and how do we bang that drum and favour in terms of making sure that people don't get lost in their careers. So please, I hope that the stories that I share are useful, they're valuable, if not entertaining, and ultimately reflects on some of the issues that you might be experiencing early in your career, preparation for the challenges that you'll face later on, the opportunities that you have to help people when you're a bit further on. You do that really well based on choosing to help people earlier on in your career as well. So there's a real circle in terms of what that looks like. But I've only got 20 minutes and lots to get through, so I'm going to jump in. I think it's important to say, it feels special to be here, not because of the scale or the program or the intention, but because rooms like this represent something far deeper. So here's the first COVID reference. There'll be a few, but next slide, please. And I suppose what it represents is a belief that people are inherently good, a belief that when given the chance, people rise, and a belief that talent is not the problem that we're trying to address. Because if we were, we wouldn't see as many as 1,500 people, capable applicants, year on year applying for probably not quite enough places on programs like this. But I hope that's something that we can address in conversation today and as we move forward as well. Next slide, please. So this isn't a problem in terms of the pipeline. This is a pattern. It's a pattern that needs our time and attention, because opportunity doesn't circulate with the same generosity as the beliefs I've just mentioned. And the distance between talent and opportunities where careers are made, stalled, or quietly lost, as Favour alluded to earlier on. And here's the uncomfortable truth. Opportunity is not neutral. It flows through networks, through familiarity, through comfort, through people who already have access. And for those without that access, the journey includes what I like to call unseen miles. Extra steps, extra effort, extra proving that drains energy long before talent is ever in question. Those unseen miles don't make people weaker. I think it's important to note that they often make them extraordinary. But they also make the climb, and the career climb in this term, far more costly than it should be, which means this: you don't intentionally design for fairness, you unintentionally design for inequality. And every one of us in this room is either widening that gap or closing it. I'll say that again. Everyone in this room is either widening that gap or closing it. Next slide, please. Today, I want to talk about that gap, not to shame anyone, not to criticize any system, but to show clearly and compassionately how we close it together. And that design advantages some and it exhausts others. But let me begin with a moment that changed how I see careers forever. Next slide, please. Oh, actually, you know what? It's funny how these things work, but I'll roll with it. I went a little bit early. Before I get onto this moment, I probably should share a little bit about myself. And I'd like to tell you who I am, and why this conversation matters to me so much. My name is Yam, as you heard earlier on. I'm founder of the Black Sherpa and the 29K Club. And these are communities built to help talented but often overlooked professionals gain the clarity, confidence, and community that they need to turn potential into momentum. So I've spent nearly 2 decades in the life sciences sector in sales, learning and development, strategy, and organizational excellence with some crazy titles. And across every role, I saw the same pattern. Brilliant people doing exceptional work, but often some of them struggling to access the visibility, context, and advocacy that actually moves careers forward. Not because they lack talent, but because they lack context. That realization sharpened and shaped everything I do now. And the moment I'm about to share with you is a moment that made it really personal. When access improves, 3 things happen. Teams sharpen, cultures become magnetic, and organizations become harder to compete with. So here's my moment. A few years ago, I applied for a chief of staff role. It was a real step up for me at the time, a role I'd worked towards intentionally, a role that I felt ready for, not out of ego, but out of evidence. I prepared, I'd spoken with senior leaders, I did the work. The first screening call arrived. Gang rang was probably a little bit like this, just about right. My notes were ready and set. My heart was kind of beating steady, but not quite. I had that little feeling. You'll see on the picture there, this is me on that day actually with a nice new perfume, which I just spritzed up. It also happened to be COVID. So although I felt nice in this perfume that my wife had got me, it boosted the confidence a little bit. The funny thing is that nobody could smell it anyway. I looked sharp from the waist up, as you can see, but from the waist down, it was probably a lockdown etiquette, which meant what I was wearing was probably up to interpretation. I'll let you guys figure that out for yourselves. And it came to that point, you know, where whatever you've rehearsed was perfect. But actually, in reality, things start to fall into improvisation. Next slide, please. I'll begin my introduction. Before I finish my second sentence, the lady on the other side of the Zoom call says, based on your experience level, I'm not sure you'll be competitive in this process. Not based on my capability, not based on my potential. Next slide, please. Just experience. The one thing that no one can gain without being given a chance. In that moment, I felt something familiar to far too many underrepresented professionals. Felt kind of small. Like the decision had been made long before the conversation had even started. But on that day, something in me refused to accept that. So I asked, is there anything that suggests I couldn't develop the competencies required for this role? Felt like a really clever question, actually. I was feeling myself in that moment. She paused, like a real pause. And she said, no. So I smiled. Next slide, please. And I said, brilliant, because we've got 27 minutes left. And I'm going to use every single second to convince you that I am the right person for this job. The energy in the room, the virtual room, immediately shifted. She laughed, and the real conversation began. Next slide, please. But I think the most important part of this story is what happened after the call. Kept the conversations that I raised with the senior leaders. And when they asked me how the process was going, I said calmly and clearly, here's what's happened so far. Here's why I challenged it on that call and continue to do so. Here's why I believe potential matters just as much as experience, especially in roles like this. Here's how early decisions quietly narrow opportunity. And something remarkable happened. I think this is testament to an amazing organization that I was fortunate to work for at that time as well. But good leaders listened, good leaders reflected, and then good leaders acted. A conversation started at senior tables, not just about me, but about the system. And then came a Teams message from the managing director. Yam, are you free to talk? this wasn't normal for me, by the way. I kind of knew who he was, but he didn't reach out on Teams and ask me questions. Obviously, I kept him waiting a few minutes just to make sure it looked like I was working just as much as I thought I was. And then we spoke, and he said, "Yeah, you've challenged us with respect, with clarity. You've helped us rethink the value of potential in this particular moment. So we've reopened the process for this role, and you're in." It's a big smile on my face, as you can imagine. He also said to me, just to bring me back down a little bit, now the door's open, others will have the same chance. So there's new people coming into the process. It's going to be competitive in a different way now, but I wish you all the luck. You've earned your place in the room. So I went forward, competed, made it to the final two. Now, some of you guys are probably thinking, wow, he got the job. And I didn't. It didn't work out like that for me. But yeah, cheers, Faber. I saw you laughing. I appreciate that. But that was never the victory on this case, right? The victory was I was never meant to even get the chance. And yet, through clarity, advocacy, and courage, the system shifted, even if it was just a little bit. Next slide, please. That moment taught me three things. People are inherently good, but systems need accountability. Good intentions don't fix structural barriers. Second thing was advocacy, in this case, self-advocacy, is not arrogance. It's clarity in motion. Speaking up didn't close a door for me, it opened one. And the third thing is career progression isn't just capability. It's guided independence. I didn't get the role, but I gained something more powerful. Belief that I could influence systems and compete at the highest level. Next slide, please. So before that moment, I'd spent years in what I'd call maybe the messy middle, delivering, performing, adding value to our business, but not progressing at the same pace of my capability. I was doing more than ever, but going nowhere fast because barriers I was navigating were invisible and to everybody except for me at times. And it taught me something profound. Success isn't shaped by skill alone. It's shaped by access to context. The unwritten rules, the informal expectations, those quiet conversations, how things really work around here, the truths that nobody teaches you. Some people inherit all of this context. Others have to build it from scratch. Next slide, please. Remember just one thing from today. Let it be this, please, guys. Underrepresentation doesn't mean minority. It means missing context. Not missing talent, not missing ambition, not missing capability. Missing the unspoken insights that accelerate careers. And here's the part that most people never admit. We judge people all the time on outcomes that were never given the context to be able to produce. Next slide, please. Context to me is the greatest multiplier of career velocity. And since there's a really random pawn on the screen here that you can all see, I want to share that it's a reminder that in the game of chess, every pawn can become a queen, and the queen can move wherever they want across the board and potentially the most powerful character on there. But it only gets there if the right path is there for them to reach the other side. Talent isn't the issue. Access really is. And this is why guided independence matters. It restores the context people were never given. If you remember nothing else today, talent creates performance. Context creates progression. Next slide, please. these guys. So in 1953, Sir Edmund Hillary and Tenzing Norgay became the first to reach the summit of Everest, which is 29,000 meters above sea level, which also happens to be what inspires the 29K Club's name. But before them, there were decades of failed attempts. Those climbers weren't lacking skill. They were lacking context. Context about the mountain, the conditions, the dangers, context about the preparations, context about climbing collectively, not competitively. And here's the part that history forgets. Progress began only when climbers stopped hoarding information and started sharing what they had learned, turning failure into insight and insight into access. Hillary and Tenzin didn't just stand on the shoulders of giants. They stood on the shoulders of shared context. Next slide, please. And even with all of that knowledge, one factor was decisive. The Sherpas. They didn't just carry supplies, they carried context, clarity, confidence, community, guidance, environmental intelligence, a route, a rhythm. In other words, guided independence. And because of that context we shared, the summit became possible. And I believe careers work very much in the same way. People don't struggle because they lack talent. They struggle because they lack context. Not underrepresented in capability, underrepresented in access. And that is the gap that this program exists to close. Next slide, please. So this is the part where it gets a little strange, a little weird, but please stick with me. You're doing a great job so far. I'd like you to take a moment, find some stillness. You can even close your eyes if you like. I don't know if we've got that level of psychological safety in the room yet, but hopefully you're somewhere where nothing can happen to you. I like to think of one person in your organization or one person in your community. Really think and visualize them. I want that person to be capable, ambitious, ready, but unseen. Think about that person. And then think about the fact that every organization community has overlooked someone who deserves more, not out of malice, because no one took responsibility for their context. Someone doing everything right except being close to the right information. And hear me out on this, guys. I don't care how junior you think you are on this call right now. This applies to you too. Everyone in this room has the power to shift the trajectory. Everyone can play the Sherpa role. Next slide, please. Now ask yourself, what happens to that person's trajectory if you become their Sherpa? Not somebody else, you. Their source of context, clarity, and guided independence. Not carrying them, not rescuing them, guiding them. If you allow me to reference this rascal on the screen, the Fresh Prince of Bel-Air, I'm showing my age now because, you know, Will Smith is what Will Smith was, the red table, that slap, things have changed. But back in my day, like, he was the guy, I'm not going to lie. But the Fresh Prince of Bel-Air was about a kid from a tough environment who thrived not because he changed who he was, but because he finally had access to the right context, to the right people who showed him new rules, new rooms, new possibilities. And for me, it's the perfect metaphor for social mobility and social inclusion. Context can turn someone's past into power. And that, to me, that's leadership. That's legacy. So your job isn't to open every door. It's to make sure that the right people know where the doors are and how to walk through them with confidence. Next slide, please. So maybe some context on the Black Sherpa and the 29K Club. And I researched the needs of talented and overlooked professionals. Essentially the work that shaped what I'm building right now. I heard like the same thing from 92 people in our industry which were kind enough to share their perspectives. I'm capable, I'm ambitious, I'm ready, I'm walking alone without the context to move with confidence. And for me, it mirrors the work of HDR UK because people aren't time poor. They're energy poor, surviving the week, navigating bias, carrying invisible labor, trying to decode these unwritten rules, trying to access fields like health data where opportunity exists, but access doesn't always follow. I think important for me, this is important because this isn't ED&I work. This isn't about equity, diversity, inclusion, belonging, just. Although those things are crucial, it's just one piece. This for me is about talent. It's about culture. It's about performance. Because when people have clarity, they have the map. When they have confidence, they have belief. when they have community, they have the support that they need. They don't just feel included, they perform better, they innovate faster, they stay longer. If you can add sponsorship, real sponsorship into that mix, everything accelerates. And this isn't just a side program, this is important, guys. If this is done right, this becomes a national talent engine, and HDI UK are really helping to build that future for us in collaboration with 10,000 Black interns. Next slide, please. I've just got a couple more, so I'll wrap up really quickly. When you view this as performance and not EDI, hosting an intern looks very different to me. Hosting isn't about administration, it's about transformation. Hosting says, I will share my context, I will use my social capital for someone else's climb, I will make the unwritten rules visible, because here's the truth. If hosting feels optional, it's because we've normalized the world where access is optional. In that world, talent doesn't fail. It simply runs out of places to go. Young people enter asking, do I belong here? They leave saying, I know where I fit and I know what I bring, not because of motivation, not because of luck, but because somebody offered me clarity, confidence, community, and that guided independence. Next slide, please. So I want to take you back one final time to that moment on the screening call I talked about at the beginning. The pause before she answered, the moment where belief and doubt shared the same breath. In that moment, I didn't need sympathy. I didn't need a shortcut. I didn't need a favor. I needed what the Sherpa offers, that guided independence, a hand to steady me, a map to orientate me, a community to climb with me. Every leader in this room has the power to provide that. So to the young people listening to me here today, you are not underrepresented in talent. You've been underexposed in context, and that context is learnable. You can learn it. So carry these three truths with you. Ask for context, boldly and often, because that context is oxygen and it's your right. Second thing is to build community, not competition. The team that you support around you and support you will take you further than climbing alone. We often see that quote about, if you want to go fast, you go alone, but if you want to go far, we go together. And the third thing is to advocate for yourself with clarity and evidence. You don't need the permission to be brilliant. Just go and do your thing. So your job is not to climb alone. Your job is to climb with intention, and let people in this room support you with that guided independence, because you deserve access, you deserve opportunity, you deserve belief, and you deserve to discover what your talent becomes when this system finally catches up. And to the leaders in this room, talent is everywhere. Opportunity really needs to catch up. And every one of us, with our choices, with our clarity and our courage, can fix the rope, can open a door, can change a climb. For someone who deserves that summit, if you fix one rope, if you open one door or share one piece of context, you won't just change your career. Potentially, you'll change their story. Thank you.
Thank you so much, Yam, for that thought-provoking keynote address. It has given me lots of things to think about, and I'm sure everyone's gears are turning, thinking about what they can do to be a Sherpa to someone else, what they can do to help fix a rope. I'm someone who likes to hold on to key sentences from anything I've read or anything I've listened to. And I'm just gonna say something that just kept jumping out to me throughout your keynote address. Access is the issue, not talent. There's talent everywhere. The issue is access. As individuals, we should constantly seek other people who we can be shepherds to. Mount Everest was only conquered because it was done collectively and not individually. All of us on this call today, we should actively seek people we can improve their lives in whatever little way possible. Personally, something I do, since I left the Black Internship program, I have made sure that every year after that, someone has applied to the program because of me. That has been my little way of being a Sherpa and of contributing to someone else's journey. Because, like I said earlier, I would have been lost if not for the Black Internship Program. And if I can make someone's journey shorter, why not? Right. So, in the interest of time, we're going to be moving on very quickly to the panel session. On the panel today, we are joined by some interns. So if you're on this call and at this point you're still unsure, what are you doing? If you're still unsure of whether you want to apply to the Black Internship Program or not, we have two interns. We have Dobrin joining us today, and we have Sandra. We're also joined by two host alumni. We have Saul from Bupa and Michael from Cancer Research UK. In just a minute, I'm going to let them introduce themselves and we're going to have questions for them. And if you still have any questions that you haven't put in the Q&A box, please don't hesitate. Like I said earlier, there are no stupid questions. So if you have any questions at all, please leave them in the Q&A box and we'll get to them shortly. So now onto the panel discussion. Dobrin, if you want to go first, to introduce yourself.
Hello everyone, my name is Dobrin. I'm currently a third year pharmacy student, and this summer I participated in the Black Internship Program at the King's Fund, which is a health policy team.
Thank you. Michael?
Good morning, everyone. Hope everyone's enjoying this session as much as I am. My name is Michael Taiwo. I'm here from Cancer Research UK. Had the pleasure of hosting multiple interns through BIP. Yeah, happy to be on the panel.
Thank you. Sandra?
Hello everyone, my name is Sandra. I was an intern in 23. I currently work as a data and insight officer with NHS South East London ICB. Really good to be here.
Thank you, Sandra. Last but definitely not least, Saul, if you'd like to introduce yourself.
Yeah, hi everyone. I'm Saul. I work for Bupa in Bupa's UK private medical insurance business. I manage the data science team, and my team, along with our healthcare analytics team, have had two interns from HDR UK for 3 years in a row, and we've been very happy with all of them, hence why we keep coming back for more, and look forward to having two interns in 2026 again.
Awesome, amazing. Thank you so much for the introductions. So without further ado, we're going to get right into the questions. So the first question, and I'm going to direct this to the interns, whichever one of you wants to go first, or yeah. So assuming I'm someone who wants to apply for the BIP, but I have no idea on how to get started. I have no idea on what to do. What is the one piece of advice that you'd say I should take with me and leave every other thing? If you had just one advice to give me. Yeah, Sandra, go ahead.
One piece of advice would be to apply. Just listening to everything that was said today, from Martin down to Yam, you can really tell that this program is really impactful. Personally, from my experience, just like Favor, if I hadn't been on this program, I wouldn't be where I am today. I've been someone that never worked in health before, but I've had prior experience working in other sector. This program really helped launch my career into health data science. And I will encourage you to start. You don't need to be an expert. You don't need to know everything. You don't need to have worked in health. You just need the passion to make a difference in health. And that's what is really needed for you to apply. So do not hesitate to apply and always reach out. And there's so much support also within the program that you can reach out to. And I'm really looking forward to when you become interns as well.
Exactly. Thank you so much, Sandra. One of my mantras today is everything is figure outable. I don't know if that's a word, but that's one of my mantras. And it's something I developed or gained from the Black Internship Program. Going into the program, I had very little knowledge. I mean, I was doing a master's in data science, but in terms of actual knowledge, I had very little experience. But the program taught me and reinforced the fact that everything can be figured out. Everything is figure outable. Dobrin, would you like to add to that?
My piece of advice would be not to talk yourself out of applying. And like Sandra said, you don't have to be an expert. I came from the other side of having a health background, but not necessarily a data background. And I think I kind of worried that I wouldn't have the skills. Maybe I wouldn't be able to like adapt to the level of coding that they used. But when I was at my internship company, I was definitely supported throughout, and the knowledge I had from my professional background definitely helped me. And I think it also gave me a specific perspective that was very helpful in the company and just throughout my project when I was there.
Exactly, exactly. Thank you so much for sharing, Dobrin. And I'll give one question to Michael. So my question is, what motivated your organization to become a host? First off, how long have you been a host for? What motivated you to become a host? And what have you gained from partnering with the program?
Thank you. That's a great question. Cancer Research UK has hosted at least 6 interns from the Black Internship program. I had the pleasure of hosting my intern in 2023, but we did have an intern a year before. In terms of motivations, I personally, I think Cancer Research UK is a great place to work. We're already active in terms of early careers programs, the more generalist ones, and I've been part of those. But certainly, looking at a mission-oriented organization such as Black Internship program was something that I thought would add a lot of value, both to the organization Cancer Research UK, but also in terms of changing the trajectory of many early careers Black interns. So it was a perfect, harmonious fit because, we love taking in early careers opportunities, but there's obviously this great mission, this great challenge that the Health Data Research UK is trying to address. Furthermore, there was a need to improve certain practices and capabilities in terms of just navigating the data landscape, understanding how we could change our tooling, our ways of working in order to tackle data-driven challenges, but not necessarily in some pockets of the organization really knowing where to begin. So taking on this opportunity really forced us to address that question in a time-bound, safe to fail, but rewarding to succeed manner. And it really just gives us the tools and the methodologies, as well as the talent, getting that right person in, just to get the ball rolling, see what happens in this 8 to 12 week period, document the findings, anything that can live on in the long term, we get to keep it, and we take those benefits as a host organization. So really tremendous decision, and it's certainly something that I myself have been able to keep going when I've taken on further interns over the years, but also a number of other teams in our organization have taken on interns and have had an extremely positive experience in doing so.
And Favour, I'll come in on that as well, if you don't mind me pushing in, because I thought it was worth sharing. One of our healthcare analytics managers found out about this scheme quite randomly. They used to work with the Health Foundation, and one of their ex-colleagues posted about it. So probably shows that all the hundreds of thousands of times Rachel and Donna and all the rest of the team have badgered people to, share events and share links and posts, etc. It does work. So that's how we came to find out about it. Bupa's made lots of efforts around inclusion and diversity in the last 2 to 3 years, high-level promises. We've then had kind of more lower-level team promises. It can feel very abstract. It can feel like you just sat in a room talking and not really doing anything. So we kind of found out about the internship a really great time, kind of similar to what Michael was saying. What a great opportunity to practice what we preach, and give people a chance, very much along the lines of what Jan was saying earlier. So that's how we came to kind of get on board.
Thank you both for sharing. Those are really fantastic insights. Thank you so much. It's heartwarming to know that you've enjoyed your experiences as hosts, because it will be weird if it's just the interns enjoying their experiences. So it's really nice to see that it's a mutual enjoyment of the program going on. We've gotten quite a number of questions, and I'm going to be running through some of them. So this question is for Yam. And I'm just going to read out the question. So it says, I love your point that we're either widening or closing the gap in access and opportunity. There's a lot of shame in Britain about those gaps and the country's history. So, how do we engage better those who are unwittingly widening the gap without scaring them away? It then goes ahead to say, thank you for a great talk. I wish I spoke as well as you.
Very kind. I really appreciate the compliment and it's a really thoughtful question, right? There's no easy answer to it, I think, is the truth. I think one of the things that we've got to be really careful is it's so easy when we see a path forward in terms of what should fairness look like and how should inclusion look like. When it's clear to us, it can totally be as unclear to somebody else, and somebody else's opinion will be in their mind completely right. And I think in that case, we can't just focus on calling people out for what we see as bad behavior. We need to focus on finding the right ways to call people in. And I think that's the skill that we need to be able to develop. I think we also need to recognize that we're not going to win every single battle. And one of the things I've seen around this type of work in the past is we work so hard on trying to find the silver bullet solution, like we're going to fix the challenges that we see around equity, diversity, and inclusion. We're not. That's not going to happen. The world that we live in is inherently unfair. And actually, we talk here about the challenges for minority, Black and brown people, let's say, but actually, it's a human thing. People look after their own. It's normal to an extent. But the thing that makes us as humans different to the other animals that we share the earth with is we can make choices that might not necessarily benefit the other people that are just like us, because we know on the whole we can change. So I suppose my question and response to Matthew is, don't look for the silver bullet that then brings this fairness to everybody, because we'll never get there. Just think about what are the small things that you can do within the scope of your control. And that might be at your dinner table. It might not be even at work. It might be just the conversations that you're having at home. But then it could be the conversations that you have at work. It could be how you take your positivity and view into that of these issues or topics into your community, and then look to build from that perspective and know that even every challenging conversation that you have potentially moves somebody forward just that little bit. So for me, I apologize that I'm probably not giving you the answer that you want here, but I think the reality is stay positive, stay focused, stay doing things that make a difference in a positive way, and know that that makes a difference. And if everybody's just doing that little bit, we'll have progress. And for me, progress is the key here. It's not about solving it. Although I'd love that. That'd be amazing. I've got two mixed race, beautiful kids that are going to have challenges around that we face in here when they get into the workplace in 15, 20 years. So for me, I'm not going to fix that. I'm going to focus on how do I make sure that they are ready, and then they understand their value and they understand the spaces that they're working through so they can move with clarity and confidence. Thanks for the question, Matthew.
Thank you. The journey of 1,000 miles begins with a step. So it's the little steps that count. Thank you so much for that fantastic response. Penny, I have a question for you. So someone has asked if you could add one new element to the program next year to make it even more inclusive, what would that be and why?
Thanks, Favor. I've been looking at this question for the past 5 minutes and it's really bugging me. So I love the fact that everyone, I'll follow on what Yam says. I know it's a tendency for everyone to go for the silver bullet, the one thing that's going to change everything. It's not going to be as easy. So I'm just going to say a combination of two things, and I'll explain why. I will choose to focus on the structures because I really think we have a great talent pool. So maybe we shouldn't focus on that, and we see the desire growing from applicants. But we don't see an equivalent arise from the host organization pledges. And of course, this is an issue of capacity, and there's numerous other issues, financial issues for host organizations themselves. So I would choose to focus on having more host organizations pledging so that we can host more applicants. But I do want to highlight that inclusion is not just about access. If these people have access, but their experience is not good, that's going to further traumatize them and be detrimental for their career. So make more spaces, but make sure these places are inclusive, and that will come with changes in the processes and systems that the host organizations have, and to make sure that these great, talented people are going to have a great experience and then hopefully further bolster a further career within the sector.
Thank you. Thank you so much. And I love the fact that you pointed out the fact that it's not just about giving the access, because if you give the access and the person doesn't have a good experience, it's way worse. So it's also it's a double-edged sword. Give the access, but make sure that when the person gets the access, they enjoy the experience, and then they want to bring other people in. I'm sure myself and Emmanuel wouldn't have been interested in hosting this session if we didn't have a great experience when we were interns. Thank you for that answer. So I'm going to ask a question, and this one is from Caroline Cake. She was one of the founders of the program. And her question is, so she says, thank you for an amazing session today. One of the things when we first started the program was to see whether health data science would change as a result of new people coming into health data science. And then her question says, are we seeing new health data science being developed? So like new methods, new research questions. Are we seeing new research questions and new data sources as a result of these new capabilities? I'm going to direct this question to Saul first, and then to Michael.
Okay, I feel probably the least qualified to answer that question. Bupa being a private corporate organization, you know, I guess we are probably the black sheep in your stable of host organizations, in that we're a private company. You know, lots of the focus of the other hosts is in the public health space, which I think it's great for HDR UK and for us to be able to offer your interns, you know, something a bit different, and certainly a more corporate kind of slightly more corporate focused internship is still really great experience for them. So I don't know that I'm seeing anything specifically just in the 3 years that we've been taking interns, but like I said, we're, you know, the kind of healthcare analytics that we've been doing, very similar questions, you know, reducing claims costs and improving health outcomes, you know, are kind of quite stable, you know, and we have quite a lot of challenges around health outcome data linked to things like, you know, ethnicity and various other, you know, diversity measures. Anyway, in terms of GDPR and just the structure of our claims data, that's the main driver of lots of our healthcare analytics. So definitely, I think what I have seen is much more thinking and focus around unconscious bias in modeling. You know, where we're doing predictive modeling, it's impossible to build a predictive model that isn't biased in some way, you know, but much more thinking around that, and, you know, governance structures being put in place. So yeah, that's probably the things I've seen change most in the 3 years that we've been taking interns. As like I said, not necessarily, you know, I can't credit all, that purely from the interns, but yeah, it'd be interesting to see what others experiences have been.
Thank you. Michael, do you have anything to add?
It's certainly a question that provokes a lot of thought. I think it's very easy to look at the benefits of the ourselves as host organizations get, even if sometimes it doesn't easily map onto, you know, the long-term mission of HDR UK. But hopefully I can share some context that starts to, you know, bridge in the individual organization benefits as well as the long-term goals of you know, tackling these healthcare inequalities by furthering Black intern representation in health data science. So Cancer Research UK is a multifaceted organization. as part of our organizational mission to make sure that people live longer, better lives free from the fear of cancer. We have existing capabilities that make information findable to information seekers. So, sometimes this is, data about healthcare inequalities, and there are already existing and established teams and capabilities doing that type of data science. Because of my background, because of the team that I work in, I really like to think about how technology can become an enabler and how technology can support those teams, really get them the bang for their buck and the bang for their efforts. So where we've got teams using disparate tooling and disparate methods, just really cobbling together bits of R code, bits of Python, bits of Excel, how do we streamline the technology provisioning, making sure that those people can be enabled to do their very best work. So the types of intern projects that I've led on, orchestrated, and delivered have really been geared towards maximizing the impact of our existing teams who do that type of job, and we are seeing the results. So we've trialed lots of I will name drop names and tools, not necessarily as a go off and use these tools, but in terms of this is what's worked for us based on our context. We've used tools like Amazon Web Services SageMaker. We're also looking at the tools and the capabilities within them, just making sure that if we can start experimenting with these tools in this very, time box, safe to fail environment, whatever we learn from the benefits of using these toolings, we can then propagate and we can actually change the health data science landscape by changing our ways of working and changing our tooling and our methodologies. So hopefully in that answer, you can start to see how our individual approaches as an organization starts blending with the long-term ambitions of HDR UK and the Black Internship Program.
Thank you. Thank you so much for that answer and for your perspective, Michael and Saul. I'm going to move over to you, Professor Martin, and I have one question for you. So my question, and it's not mine, it's just, well, I mean, it's mine too, because I'm interested in knowing. So the question is, from your perspective as chair of the advisory group, why is the Black Internship Program, and I know you touched on this a little bit during your welcome address, why is the Black Internship Program strategically important for the health data science sector in the UK and in the wider context of Europe and the world generally?
Great question. Probably the same question Caroline asked and I asked years back when we started this off. I will answer it in this way. There is so much we don't know in our world that with only the conscious thought of bringing multi-disciplinary groups together can we find real solutions. I know, as somebody that comes from the global majority, that for years, the research question or problem we were trying to look at was probably not in the context or the content of the bandwidth that's given to us. Take sickle cell, or take certain types of diabetes that can only be viewed, worked on, and expanded on if those who have suffered from it are actually in the room. I had the great opportunity only recently to go to Iraq, which is completely devoid of a diabetic management system, population that is actually exploding. And yet we sit in the West and to a certain extent, a degree of arrogance, believing we have the right solution, the right collectively. And this is where I think the expansion program brings in those talents that are generally left out the room to ask a very difficult question. And we shouldn't be frightened of standing up and recognizing that actually we are a community of diverse individuals. Whilst we look for unity, it's that on uniform method of thought that actually rapidly answers to complex issues. So is this an important program? Yes, it is. It was from start day one where we were trying to answer the questions that we didn't know. Has it proven that there is a journey still to go? Yes, there is. What is thankful, it's been done in the UK. We have had that flexibility and that understanding to have those conversations. Question is, how do we expand that beyond the small island we sit, so that the knowledge we've gathered, even on where some places sit in the insurance market, to be able to maintain, how do we ensure that generations have a best way of life? And it is programs like this that make it happen. So thank you for that, David, even though we're stuck going around the corner to answer the question.
Yes, absolutely. Thank you. Thank you so much, Martin. I'll ask one more question to the interns, and then I'll let my co-host take over. So this question is for Dobrin and Sandra, and it says, I have a question for the interns on the panel. As a host organization, I'd be keen to know if there's anything you either experienced or didn't and wish you did from your host that you felt was key to the success of your internship. And Dobrin, I noticed your hand was up prior, so if you want to add the point from that as well in your response. So I'd let you go first, Dobrin, and then Sandra.
In regards to the last or question previous to that about if we're seeing a change in the like health data space, I would say from my perspective as an intern, maybe specific to my company, because they typically do maybe commentary and health policy. There wasn't anyone on my team that I was aware of that actually had been a healthcare professional. So I think related to my project as a pharmacist, I was able to help with a lot of insight, and I did a project specific on weight loss medications, which is very topical, but I think also having the clinical insight helped a lot. And I think being able to maybe inform the team of more resources that they might have not known before because they were quite data orientated. I think in the future they could look more into medications and topics on that. So I think maybe specific to my policy, I know that in the future there is that kind of change that they'll feel a bit more confident maybe to speak on those topics. Specific to my internship experience, I think the biggest factor of it being successful was genuinely being integrated into the team. Um, Especially being quite a young individual and working with professionals, there's kind of some level of anxiety of maybe they will think I'm not competent or maybe I'll kind of be put in the back burner. But from day one, I was treated as someone who could actually contribute and not just observe, which made a really big difference in my confidence and actually learning. And I think what helps me was having like structured check-ins, clear expectations, and a project that actually mattered to the team and I could tell it mattered. It wasn't kind of just like a fill-in for me to do while I was there. Um, and it tied directly to conversations they were having at the time. And I think it's an experience I'd want every intern to have with the balance of like support and autonomy and feeling guided but trusted. So I think that's a really big impact that host companies could have.
Thank you. Thank you so much. Sandra, do you want to add anything to that briefly, please?
Thank you, Emmanuel. I think Darren said it all. Definitely, the experience from the host organization makes a huge impact on the intern. For me, I had a really great experience from HDR's team and as well as my host organization. And these people have consistently been in my journey. Even when I've left, they were very interested in knowing, how far I was faring, what support I needed. And for every time I had reason to ask question, I felt like I could go back to them, and they were almost like sponsors as well in an indirect way in my current career. So I would say definitely it does.
Thank you, thank you, thank you so much. So because of time, we need to end the panel session now. But before we wrap up, I would like to invite each of our panelists to share just one thought, one brief final word, very, very brief, just one key thought that you would like to leave with everyone as we bring this discussion to a close. So let's start with Sandra. Sandra, what's your final thought quickly?
Really so proud to be part of the HDR UK being an intern and just being part of this program where we're celebrating 5 years of impact. Looking at that chart in the initial slide, I was really proud of how many people consistently are feeling like they can apply, and then seeing the number of uptake coming from hosts. I'm really hoping that more host organization, and for myself actually, I'm going to start having this conversation with my current employer to see how, they can come up as well. So definitely, I think I've said too much, but one thing I'll say is I'm really proud of the work that we're doing, and I'm proud to be an alumni.
Yeah, thank you. Martin?
Quite simply, you really want to gauge what the weather is. Step outside.
Thank you so much. Michael?
I would say that the data landscape is changing across the world. Tools like generative AI is really getting organizations thinking. Now is the time to be a host organization. There are lots of data challenges that organizations have, that you're going to need a safe place to explore these challenges. You're going to need to bring in fresh talent to support you on this journey. So I'd say don't hold back. Think about those projects. Sign up to become a host organization. It's going to be worth it.
Thank you, Michael. Saul?
Well, I don't want to just copy what Michael said, but absolutely echo all of that. Well, I'll speak to the interns, the people that are thinking about applying for an internship, or anyone else. Look beyond the obvious when we're. That's what success looks like. You might be going down the rabbit hole, deep in thousands of lines of your code, or deep in a spreadsheet, and you're looking at something. What separates the great from the good is being able to step back and think, okay, what does this mean? If it's, a chart of diabetes outcomes split by age or gender or claims costs or readmission rate, okay, that's great. What am I going to do next? How can I use that for Bupa? How can I use that to improve outcomes, lower costs? How can I use this to, improve cancer care in the UK? When you're deep in that detail, always just try and take a step back, understand the broader process, whether that's business process or public health processes. How can you stay focused on what you're looking at, and how that can improve the process.
Thank you, Saul. Dobrin?
I'd say it's definitely rewarding for both host companies and the future generation to be mobilized with the confidence that they can make an impact on the areas they're going into.
Thank you. Penny?
Thanks, Emmanuel. I think I'd start with the fact that I was very grateful to be brought into this program and have the opportunity to meet all the alumni, the HDR UK people, and the host organization staff. I think it's a great initiative that speaks volumes as a Black internship program. I think it gives a very clear message that is very much needed, especially within the current climate where such discourses are politicized for various different reasons. And I think it's this focus on not fixing the people, but trying to take a holistic view on how can we fix the systems, the processes, and the practices, while offering the talented people that are out there with the opportunity to train, be mentored, have the work experience they're missing to get into the systems and bring change and innovation.
Thank you. Last but not the least, Yam.
Wow, hard to follow. I think when I think about what we've seen here, the truth is the world is unfair, but the future is a connected pipeline, particularly when we're thinking about talent. So that's interns, it's alumni, it's hosts, it's advocates, it's the leaders, right? If the Black intern program becomes the glue between these groups, then the sector wins. It's as simple as that. And I just go back to the point that everybody's got a role to play in that. And what I'd maybe sort of ask is, like, it's been an amazing conversation here. When you finish, like, take a minute to reflect on it, what's resonated with you, what means something to you, and then do something with that context, whether that's applying, getting somebody else to apply, getting somebody to host, do something that helps to progress and move this forward would be my massive plea.
Thank you so much. So without wasting much time, I would like to introduce our last speaker, who will be giving the closing remarks and also call to action, and then we'll run it up from there. So I'll call in on Andrew. Mr. Andrew is the inaugural director of the Health Data Research UK. He's professor of medicine and vice principal of data science at the University of Edinburgh, and an honorary consultant physician in NHS Lothian. He was elected as the president of the Academy of Medical Sciences in April 2024. In early 2025, Andrew joined the board of trustees at the Agency for Science, Technology and Research, Singapore, and led public sector research and development agency. So, Professor Andrew, I would like to call you up now to give the closing remarks. Thank you.
Thank you. Can you hear me? Can you hear me okay?
Yeah, perfectly.
Perfectly. So welcome everybody. And firstly, can I say thank you to so many people, Rachel, Save Favor, Emmanuel, Martin, Penny, Yam, Michael, Saul, Naambi, Sandra and Dobrin for a fantastic webinar. And thank you all for signing in. So it's a huge privilege and honor just to say a few words. And can I just say how inspiring the Black Internship Program has been, and what a privilege it has been to host it from Health Data Research UK. As we heard in the closing comment from Michael, health data science is changing so rapidly, and there's a huge national, international demand for new talent. And when we set up the Black Internship Program, it was a bit experimental, but I think we've proven the worth of starting small, thinking big, and moving fast, because the impact and seeing the talent flourish over the last 5 years has just been phenomenal. And I think that has been confirmed in the independent review, that it's a high quality, valued, and impactful program, and provides great opportunities for people to flourish in this very rapidly changing data landscape. So all credit to you all, and thank you for all that you have done. Saying that, we mustn't be complacent, and we need to think, right, how can we grow this? How can we support and enable greater impact? And as Martin said, let's advertise and increase awareness of this opportunity. So if you're a Black undergraduate, postgraduate, or recent UK graduate, let's shout from the rooftops that this is an opportunity to gain experience, skills, and most importantly, networks and relationships. Secondly, a call to action to host organizations, because I think we have over 1,500 applications from excellent people each year, and it always disappoints me that we've got to turn a lot of excellent candidates away. So how do we scale our host organizations? So please do spread the message, because there's huge benefits for host organizations in terms of access to motivated skills interns, plus the ability to network and benefit from this community. But in summary, we've greatly enjoyed this journey with you. We're completely committed to it. The momentum is strong, and I think with continued support, the next 5 years will deliver inclusion, creativity, innovation, and opportunities for Black interns to flourish. As I think it was Barack Obama said, the future rewards those who press on, and we're going to press on. So just to summarize, because it's 12:30, can I thank you for your commitment, your leadership, and your engagement, and to say thank you, and enjoy the festive season when it arrives. But you should be proud in everything you have achieved.
Thank you, Andrew. So that was an inspiring way to bring the discussion together. So what has come through strongly today from the evaluation, the panel discussion, the personal stories, and from Andrew's reflection is how transformational this program can be for interns and for the host organizations that welcome them. So to our host organizations, when you choose to host an intern, you are not simply offering a placement. You are opening up opportunities, shaping futures, and building a more diverse and representative health data science and workforce. And to those considering hosting for the first time, your participation makes a difference, and it helps sustain the incredible momentum this program has built over the last 5 years. With that, I'll pass over to Favor, who will encourage our prospective interns and take us through the final closing steps. Thank you.
Thank you. Thank you so much, Emmanuel. Thank you, everyone, to the panelists and everyone who has joined in the program today. We are 2 minutes over time, and we apologize for that. We're bringing this to a close in just a short while. If you're thinking about applying for the 2026 cohort, I'm hoping that this panel session and the webinar today is enough push. But if it hasn't been enough push, I'll just share a very quick snippet of my journey. So everything that has happened to me in my data science career, right from when I came into the UK until now, has been as a result of the Black Internship Program. And if you want to know more about that, find me on LinkedIn and ask me. I'll give you the story. So if that is not enough, let my story be the final push you need to make the leap and apply. And like our intern said, just apply. Don't turn yourself down, just apply. If you're interested in applying to be either a host organization or applying to be an intern for the next cohort, please scan the QR codes showing on the screen right now. And with that, I'd like to officially thank you all for joining us today for this webinar. Apologies to those who had questions that we couldn't answer. And I'd like to bring all of this to a close. Thank you so much, everyone. Enjoy the festive season and see you at the 20th celebration, perhaps. All right, thank you.